Welcome back. Well, diabetes is one of the comorbidities often named as a risk factor during the COVID-19 pandemic. It doesn't mean that if you have diabetes, you're more likely to catch the virus, but it might mean that you're at a greater risk of dying from it. There are also some reports of what's called new-onset diabetes after patients contracted the coronavirus. Professor Dave is the head of endocrinology at the University of Cape Town. Margot McCumisky is the national manager of Diabetes SA. They're both joining us now with more on this. Professor, good evening to you. Let me just start with you. Diabetes affects so many people, millions of people, also pre-diabetic. What makes people with diabetes so vulnerable to this disease?
Good evening, Stephen, and thank you for having me on the show. You're right, there are over 450 million people living with diabetes globally, and in South Africa we have about 6.5 million people living with diabetes. And so there was no doubt that the paths of both of these pandemics were going to intersect. Now, there's a couple of reasons why people living with diabetes would be more susceptible to more severe COVID-19 disease. One of these is the entry port by which the virus uses to gain entry to cells is higher in the levels are higher in patients living with diabetes. Patients living with diabetes have a dysregulated immune system, which puts them at greater risk of developing what they call the cytokine storm. It puts them at risk of multi-organ failure and adult respiratory distress syndrome. And then people living with diabetes are also more likely to be older, they're more likely to be overweight or obese, and they're more likely to have other associated comorbidities. So all of these, in addition to each other, put people living with diabetes at greater risk of having more severe COVID-19.
Does it matter which diabetes you have, type 1 diabetes or type 2?
The data is emerging from around the world that all people living with diabetes are at risk of more severe COVID-19. Obviously, the numbers of people living with type 2 diabetes are much greater. So these predominate, these patients. But unfortunately, all forms of diabetes do put you at greater risk of more severe COVID.
Margot McCumisky, I mean, if you have diabetes, how difficult is it to manage in a situation like this? How difficult is it to manage once you've been diagnosed with it?
It is difficult to manage, and patients aren't always given the tools and the education to be able to manage it, and that is the challenge, because particularly patients in the state sector are not given the time which is required really to sit and explain and help them through the management process and the ins and outs. Diabetes is a challenging condition to have. Your blood sugars are up and down daily. Every few minutes the levels are changing depending on your circumstances, what you're doing, what you're eating, and there's so many different things that can affect your glucose levels that it takes time to adjust, and it takes ongoing support and education.
So what then does a patient need to actually do? If they're diagnosed with diabetes, obviously you're going to spend a lot of time on Dr. Google, but what else do you need to do to manage this?
Well, patients ideally should be signed up to, once they're diagnosed, to an education program that will help them to understand, explain what they need to do to manage, and also to have a support system as backup when they have questions that they need answered to help them. The doctors, whilst they do their best, they don't have the time to spend, and there are not very many diabetes educators in South Africa. So an organization like Diabetes South Africa is there to play that role, but unfortunately we don't get the support and the resources to enable us to fully reach out to patients to do this.
Professor Dave, if I may just ask you, if you are able to manage your diabetes, does that lower the risk once you get COVID-19? I mean, I'd like to think it does.
Stephen, you are correct, it does. Data now emerging from the Western Cape is showing that just having diabetes unfortunately increases your risk of more severe COVID, and more so if your diabetes is poorly controlled, especially if your hemoglobin A1C is above 9%. We've identified that group of people as being of higher risk of needing admission to hospital and at higher risk of dying from COVID-19. But unfortunately, just having diabetes also puts you at risk. So essentially, the name of the game is preventing getting infection by really adhering to all the recommended preventative measures.
It's interesting. I mean, the next question, of course, is why do we have so many people who are suffering from diabetes in South Africa compared to other countries?
Most of these diabetics are type 2 diabetics, and essentially this is driven by lifestyle. And part of that lifestyle is a lifestyle that promotes weight gain, overweight and obesity. So there's no doubt that the major part of the pandemic of type 2 diabetes is driven by obesity. And unfortunately, South Africa has one of the highest rates of obesity in the world. We certainly have one of the highest, we are the most obese nation in Africa. And we rank in the top 5 in the world with the prevalence of obesity.
Margot McCumisky, I mean, in many countries, as countries have got richer, as people have got richer, their young people have got taller and thinner. That doesn't seem to be happening here. Is there something happening in our society that has led to us being more obese?
Oh, most definitely there is. Our environment that we live in does not promote healthy living. And especially if you're on the breadline, when you've got to focus on being able to put something on the table to eat, as opposed to, living a healthy lifestyle. And particularly amongst our underprivileged communities, the focus is on finding work and being able to supply something for the family to eat. And the concern about healthy living is definitely not a priority. And also, in order to manage your diabetes, first of all, you've got to know what your levels are. And if you can't test and establish that, what motivates you to manage it, because you have no idea what is going on in your body. So being able to test would help, but also getting the education to use those test results adequately to manage your diabetes would also be extremely helpful. But the majority of people in South Africa are not provided with those tools to do that.
I do have a question I'd like to go to both of you. Margot first, if you don't mind. To my mind, it seems that this incident, the COVID-19 pandemic, has shown how short-termist everybody is. We saw a threat on the horizon. It could kill large numbers of South Africans. We went into lockdown. We banned smoking. We banned the sale of alcohol. Diabetes takes a much longer time to develop. The people who may die from diabetes often tend to be older. It's something that's happened over many years. We know that we have a huge problem with diabetes and that it kills many South Africans, and yet we're not going out and banning fizzy drinks. So my question, Margot, is do we need to sort of treat diabetes in a way as we've treated COVID-19?
Yes, I would say so. We've seen this coming. This huge number of patients with diabetes over the years. I mean, Diabetes South Africa has been in operation for 52 years, and we've been warning about this constantly, but diabetes has been very much sidelined because we've had other challenging issues on the health side in South Africa, and so not much attention has been paid. And so now with COVID, people are suddenly realizing, that this is a huge issue. whereas we should have been doing something years ago about diabetes and helping folks to manage it and helping to prevent it. 30% of diabetes is genetic. So you already have a risk factor if you have somebody in your family with diabetes. Now, I just heard yesterday one of my board members has lost 5 members of his family in just over a month to COVID-19, and all of them had diabetes. So that tells a story.
That's an incredible figure. Margot McCumisky, National Manager of Diabetes SA. Thank you, Professor Dave. Let me put that question to you. I mean, it's easy to say we need a state of emergency on diabetes. We need a state of emergency on many things, but clearly we need to pay a lot more attention to it.
Stephen, your question is excellent. Obviously, when it comes to regulating what people can eat or drink, it becomes quite political. The sugar tax has been instituted in this country, and we wait to see what effect that is going to have in the long term. I think it will have a great effect, especially if the money raised is used for educational programs around lifestyle change and the need for weight loss. I, for one, am quite a supporter of regulating what can and cannot be eaten at schools, because that's where it starts, especially government-run schools. But this question is a question that generally generates a lot of debate with a lot of emotions on both sides.
Professor Joel Dave, bringing an end to that conversation. Thank you, Head of the Endocrinology at the University of Cape Town. Margot McCumisky, the National Manager of Diabetes SA. Thank you both.